Hello and welcome to Module 4. In this module, we're talking about how we lead. So we're going to look at leading inclusion, building collaborative, accountable, and high-performing healthcare teams. In this section, I want to first talk about why inclusive leadership matters in healthcare. And it's really important for us to know the why behind it because then that helps us explain the value of the changes that we're making and getting everyone else bought in with us. So first, it's really important to recognize that leadership is a behavior. It's not just a title. It's not because you're in a certain role, you are a leader. You may be in charge of people, you may be able to control them, but that doesn't mean you're a good leader or exhibit leadership behavior. Inclusive leadership, we know, is tied to stronger patient care, is tied to better team engagement, and your workplace culture. Because when we have inclusive leadership, we're listening to diverse perspectives, which allows us to improve our decision making and our problem solving. And when we have teams that can be heard and seen and valued through psychological safety, they perform better because they are now involved in that process. So I've given you some examples there of why inclusive leadership matters, and I want to walk through them with you. So the first one I talked about improving patient safety and quality of care because staff can speak up, report concerns, and contribute to safer, higher quality care. It also strengthens your team communication and collaboration because we have respectful communication and teamwork across our roles and disciplines. Enhance psychological safety because our environment now supports people to share ideas and ask questions and learn from mistakes. We have stronger recruitment and retention, and we know in healthcare with labor shortages, that's really important because we're increasing employee engagement, their satisfaction, and then retention as a result of their belonging. We promote equity and reduce barriers because people are supporting that identification process. And the barriers could affect anyone from an employee to a patient to family members, and those barriers can be identified and we can reduce those. It improves the experience of people because they are getting care and services that's responsive to their needs. We're encouraging innovation and continued improvement because we're constantly looking at how we're developing our skills and the way that we're engaging with each other. And we're building trust and organizational culture because we're giving people the opportunity to contribute and we're showing them that their voice matters in this process. Inclusive leadership creates conditions where people are contributing their best work. And so, something we've talked about quite a bit is that psychological safety and belonging. Because ultimately, what you want to do in the workplace is you want to create a space where people feel like they can contribute. And then to feel like you can contribute, you have to be seen, heard, and valued. We've talked about that DEI framework from the beginning. Diversity is who you are, it's what we're talking about. That's being seen. The inclusion and accommodation is the being heard. It's understanding that you have needs based on your diversity. And then the valued component is that equity. It's that someone's doing something in response to your needs to support you, showing you that you are valued. When we see this through together, when we see what we're talking about, how we're responding, and we get to equity, which is our goal, we're consistently going to also be developing psychological safety alongside that process. Some characteristics of psychologically safe teams are those questions being asked, people being able to raise concerns, mistakes being aware, team members feeling respected. But as a leader, it's your responsibility to have these conversations with people, to ensure that they are understood. And a lot of those conversations require listening. So we talked about active listening and the necessity for leadership professionals, anyone in any role, to not just listen to speak, but to listen and actually understand where someone's coming from, why they think that way, and why their opinion or perspective is important. Because we need to shift from listening just to have someone heard to listening and then using that information that they're providing to then reconsider how we think about things. And this isn't always done authentically or informally. It has to be done intentionally and formally in some spots. We have to invite people to participate. Call people out. If you notice that they're not participating or sharing information, how do you ask them? How do you involve them? And how do you show them that their feedback and their participation matters? Because you can be asking people to contribute and nothing gets done with that information. And over time, if nothing gets done with that information, then we are going to lose their participation. With asking people to contribute, we also need to respond respectfully to those concerns. We may not be able to do something about it, but we need to have a conversation to show them that you're going to go through the appropriate steps to seek out support for their concerns and then reflect back with them what that process looked like, what you could and couldn't do, what barriers there are, and how you can continue maybe to advocate for them. In that, you need to also acknowledge your own mistakes and then encourage that collaboration. People are more likely to contribute ideas and raise concerns when they feel psychologically safe. So it's very important to make sure that we're creating spaces for people to do so in all aspects of our engagements with them, whether that's a team member or if that's with a patient or their families. When we talk about being good leaders, we need to share power and encourage diverse perspectives because hierarchy can affect the way that we communicate in healthcare. So, I want to talk a little bit about hierarchy with you. So, hierarchy is a natural part of healthcare in any facility, any organization that you work in, anywhere really that you have teams and groups working together. Hierarchy can affect the roles we have, our responsibilities, our expertise, and our decision making authority. So a hierarchy affects if you feel like you can speak up, if you provide information, if it impacts your patient safety, if it influences your team collaboration, and how it affects your psychological safety. So when we're creating healthy conversation and communication around these hierarchies, it's important for you to encourage that two-way feedback so that you can have an opportunity to hear what people are saying. In a hierarchy, it could be that a new staff member is remaining silent during a discussion. It could be that team members are hesitating to challenge decisions, or that certain voices are consistently dominating a conversation. So, strategies for creating that inclusive participation could be seeking participation from all team members in a conversation, rotating opportunities for leadership, encouraging those quieter voices, and valuing expertise regardless of someone's position. When we include those diverse perspectives in decision making, we're creating an opportunity to intentionally have participation. So we're saying, we want to hear from you. We want you involved. This is how I want you to share. This is where I want your voice, and you need to be a part of that conversation. When we talked about that why, and we looked at how leadership plays a role in our workplaces and how it plays a role in the way that we communicate with each other and how we support each other, we can think back to why inclusive healthcare matters in our spaces. And we talked about this a bit already at the beginning. We talked about why inclusive leadership, why inclusive healthcare matters and what we can do with that information. And so just looking back on those, we can talk about what it means to helping the people around us. So when you do this in your spaces, there's a couple things I want you to consider. I want you to consider what those root cause problems are. A lot of times we don't look at root cause problems. We simply decide that they are an operational issue. But a lot of these issues come from human issues that then lead to operational issues. So if you have poor quality of care, maybe you have a labor shortage, maybe you have poor technology use or documentation issues, something's being missed, a step's being skipped, it can tie back to the human aspect of this process. And that could be that people aren't communicating effectively, or we're not being given the opportunity to contribute to conversations about issues or barriers or a potential risk. So some of these potential risks that we're seeing and some of these areas or issues that we have could be alleviated by that change. So, as you move into becoming an inclusive leader, we need to talk about coaching, accountability, and growth. Effective leaders support that development through coaching. So, some strategies you can integrate, which we've talked about consistently, are asking those questions, encouraging people to participate in a conversation, and looking at what constructive feedback looks like for you, as well as setting clear expectations, respectful feedback, consistent standards, and support for growth and improvement. What I find most often is we set all of these very lofty goals for inclusive leadership, inclusive workplaces, inclusive practice, but we don't have accountability standards that fit with it. So the accountability compete is the component is just as important, making sure that what we're doing aligns with metrics to assess if we're doing it, how it shows up, how do we know if it's working, how do we know if it's not working, and what do we do about that if it happens. Leadership is demonstrated through your everyday actions. And when that is demonstrated, it creates trust, it creates opportunity for collaboration, and the support for success of others. And if you're working to create this in your space, it's really important to build out that plan. First, look at what you can do better, look at how you can support others, and look at what you do to be sustainable by creating that accountability. I trust that through this process, you're now able to reflect in what you may not have known, what you do know, and how you can support that knowledge for yourself and other people as you look to create those micro and macro changes in your workplace. Thank you so much for joining me on this learning journey, and I look forward to seeing what you create in modules 5 and 6 as you set a plan for your action.